Hi, I'm Jenny from Life Cycle Physio. Today we're talking about manual handling. When we think about manual handling, normally we think about people who do lifting as part of their job. But when you have a young baby, you're doing manual handling all the time because you're forever lifting and carrying your baby around. So it's really important that you do that in a safe way to look after yourself and look after your body so you don't get injuries. We'll talk today about a few different things. One is getting your baby in and out of the cot, getting your baby up and down from the floor, and how to sit safely on the floor and play with your baby as well. So let's start by talking about getting your baby in and out of the cot.
Here's Louise with Hudson demonstrating paw lifting technique. So Louise is bending straight from her back. She's not bending her knees at all. You can see there's a lot of curve in her back when she bends, and her legs aren't able to take any of the load because she's keeping them straight the whole time. So that's going to place a lot of load on Louise's back. Now Louise is demonstrating a good lifting technique. So this time she's in a semi-squat. She's bending her knees, sticking her bottom back and bending from the hips. You can see her back is nice and straight. An alternative way is to come in from the side and lunge forward, so a split leg stance, still bending straight from the hips, a nice straight back, and her legs are able to take some of that load. So a lot less strain on Louise's back.
Another consideration is what's going on with your thumb and your wrists as well. Quite a number of women end up suffering from something called de Quervain's tenosynovitis after they have a baby, and that's actually an inflammation of the tendons that run along the thumb, and quite often they'll get really sore and swollen down near the edge of the wrist where the wrist and the thumb meet each other, and they can become really, really tender and make lifting your baby really difficult and really painful. So a few things to consider. Quite often a lot of women find that if they're picking up their baby with that really wide grip with their thumb and their fingers wide apart, and picking the baby up around their tummy or around under their arms with that kind of grip, that often makes this problem a lot worse. Also, if you're breastfeeding your baby and your wrist is in an awkward position, so if you're really kinking your wrist in to support your baby, perhaps at the head there, or supporting a lot of the weight of the baby down near the bottom of your wrist, then that often can again make this kind of problem a lot worse and be really painful for you. So whenever you're trying to lift your baby, to try and minimise the stress along those tendons, really try to get your arm right in underneath your baby. So you're supporting the weight across the top part of your forearm all the way up to the elbow. See if you can keep a pretty straight line from your wrist all the way down the hand and support that baby right through your forearm as much as you can. Same when you're breastfeeding, try and get support right along the forearm. You may even like a little pillow underneath your forearm and elbow there, and make sure that you have the wrist in a straight line. Some women will need treatment with that kind of problem and may even need to wear wrist splints as well.
Here are Louise and Hudson again, and looking at a paw technique for getting Hudson on and off the floor. So again, Louise is bending straight from her back, really not much bend in her knees. Her back and hips are bending, and that's going to put a lot of strain on her back. This time Louise is demonstrating a better lifting technique. So two methods, one is to squat and another method is to lunge. You can do either of those both down and up, but Louise is showing the lunge coming up now. And you can see with both of these positions she's able to use her legs to take a lot of the load. She's able to bend from her hips, keep her back relatively straight, and it's a lot less load on Louise's back. Same on the way up from the squat position. Finally, looking at positions for playing with your baby on the floor where you'll probably spend a lot of time. So get down low with your baby. You can come down to an all fours position or in a sitting position, perhaps side sitting like Louise is doing. And you're nice and close to your baby, a lot less load on your back as well.